Hello and welcome. My name is Tola. I'm a pharmacist and I promote health and wellness. Welcome to my channel. In this video, we're going to be talking about vaginal thrush, and I know that it's a topic that people don't usually like to talk about. Now, when people come into the pharmacy, they want privacy, so they want to talk about it in private, and so that's why I did this video. For women out there that might be having symptoms and don't know what to do, just to explain a few things, and I hope this video helps someone or someone benefits from it. Okay, so let's go straight into it. To everyone that has subscribed, and please like and share and even comment. Thank you. So it's not something that people like to talk about openly, and in fact, I say to you, when people come into the pharmacy, they are hush hush about it. They talk about it, they want to consult you and they want to come into the, consultation room just to have that privacy. Vaginal thrush is an infection caused by yeast, and it affects most women at some point in their lives. Vaginal thrush is also known as candidiasis. Vaginal thrush is a common infection caused by an overgrowth of the yeast Candida albicans. Hence, symptoms appear if yeast numbers increase. So, the yeast numbers increase, thereby causing us to have symptoms. Now, this yeast lives naturally in our bowels and in small numbers in our vagina or on the genital skin. This overgrowth may occur due to some reasons, and I'm just going to enumerate some of them. There might be recent antibiotic use or oral contraceptive use. So people that are on oral contraceptives are prone to having vaginal thrush. Someone that is pregnant also, or maybe there's a change in menstrual cycle. There are also, there could be increase in yeast numbers in those cases. And also when there is an illness like diabetes or iron deficiency or immune system disorders. Now, some skin conditions, the vulvar skin conditions like eczema also sometimes could cause vaginal thrush. Sometimes as well, the reasons may not be completely known or easily identified. About 75% of women will have vaginal thrush in their lifetime. It's mostly harmless, but it may be unpleasant and uncomfortable. And also for some women, it keeps coming back and it becomes difficult to treat. So let's talk about some symptoms of vaginal thrush. There could be vaginal discomfort, like itching, burning sensation. There will be soreness around the vagina, the entrance of the vagina. There will be discharge, and this could be thick, white, and cottage cheese appearance, and it may be odorless and have a yeast smell. It could also be watery or thin. It could be thick and white, or watery and runny and thin. Now, there could also be redness or swelling of the vagina or the vulva. Sometimes the skin around the vagina can be red or swollen. There could also be splits or cracks in the genital area. Now, the next one I want to talk about is pain during sex. This may be, worrying, especially if one is having sex and one is experiencing vaginal thrush. Also, stinging sensation when urinating could be a symptom. Now, vaginal thrush is not sexually transmitted. So let's note that it's not sexually transmitted, but male partners sometimes may get redness or irritation after sex. So I want to dwell on vaginal thrush and sex. You can still have sex when you have vaginal thrush. Yes, You can still have sex when you have vaginal thrush. As I have said, it's not a sexually transmitted disease. Now, the only thing to that is that it can be uncomfortable and you may experience, burning sensation during or after sex. You can use plenty of lubricants to protect your skin. Also, for some treatments for vaginal thrush could affect condoms. They could weaken condoms. So it's advisable to use your treatment after you've had sex if you are using condoms. So treatment options that are available could include creams or pessaries. And pessaries are tablets that are inserted in the vagina using a special applicator. And they could be used between 1 to 6 days, depending on the particular product. Now, they are also available from your local pharmacy, without prescription. Now, I want to talk about when to seek help. It is very important to rule out other conditions that may be present. So, a few of these may result in symptoms that are similar to vaginal thrush, but it's important to rule them out. Okay? So, it is important to visit your doctor, options clinic, if you are having vaginal thrush for the first time. Number two, if you are under 16 or over 60. If you are pregnant or breastfeeding. Number four, if you have unusual symptoms such as colored or smelly discharge. Or if you have sores around the vulva, that's the skin around the vagina. Or if you have abnormal vaginal bleeding, or if you have pain in your abdomen. So if you have associated pain in your pelvic area or your abdomen, it's important to get it checked. Now, also, if you or your partner have had, an STI and it's not going away, or if you've treated a vaginal thrush, for a while and you think it's coming back, or, you've had 2 or more episodes within the last 6 months. You could also have reacted badly to antifungal treatment in the past. Now, it is recommended that you see a doctor. If you had repeated episodes, it is recommended to see your doctor to confirm what it's actually causing it, because the symptoms, some other symptoms may look like, or may feel like thrush. You also need to rule out the fact that, it could be an STI. Your doctor can check for the presence of other skin conditions that may have similar symptoms and exclude, other conditions that cause thrush, like diabetes, as I had said earlier. Any factor contributing to an overgrowth of candida should be identified and managed. Now, if no contributing factors are found, a course of preventative treatment could be recommended. Now, in these cases, there may not be anything to worry about, but your doctor may want to take a swab just to check what exactly it is, to confirm the diagnosis and, carry out some tests to check for any underlying cause. They may also advise you about treatment options that are available and give you a prescription if it's necessary. Now, for male partners, there's no evidence to support the fact that male partners need to be treated. Male partners of women who experience thrush, there's no evidence to support, treatment for them. All right, so I want to talk about lifestyle advice if you are experiencing vaginal thrush or repeated episodes. Now, you need to avoid using perfumed toilet papers and perfumed sanitary products. So menstrual products, toilet papers that are perfumed, you need to avoid them. Also, you need to avoid using perfumed sprays in the genital area. Now, also avoid wearing tight fitting pants and synthetic underwear. You could also consider changing your laundry detergent, which is very, very important as well. Now, there's no clear evidence supporting dietary changes. So, the research is very limited in terms of supporting dietary changes in when one has vaginal thrush. All right. Finally, thrush outbreaks, while very uncomfortable, do not cause any long-term health issues. But as I always say, if you feel worried, please get it checked. If you're concerned, it's important that you speak out and speak to someone. I also want to put a disclaimer here. We're not diagnosing or treating anything or any illnesses, or I'm just giving advice here. Thank you so much for watching this video. Please like, share, and comment, and I'll see you in the next video. Bye.